Welcome, ladies and gentlemen, to Forensic 101, the channel where the dead do the talking and the toxins keep on walking. Irrespective of the specialty that you choose, chances are that one or the other point of time, you will encounter an individual with mental illness who will come to you for management. Hence, it becomes important for a registered medical practitioner or a doctor to be able to identify the common symptomatologies and at least create a provisional diagnosis of the mental disorder so that he can at least make a differential diagnosis to make it go further. Just to give you a basic idea of the mental health problem in our country, now as per a 2017 editorial in the Times of India, 6,300 examinations were performed on mentally ill individuals for diagnosis as mandated by the court of law. And in 2017 itself, empirical data suggests there were more than 19.7 crore individuals who were diagnosed as having mental illnesses. That's just the data for 1 year, my God. Now that's a big number, don't you say? So before we go ahead and actually diagnose an individual, we have to find out the classification of mental disorders. Now there are two major techniques which you can use. The first one is the ICD-10 classification method. Now that's the most common one. It has the diagnosis of each and every condition. The second one is the DSM-5 or the Diagnostic and Statistical Manual for Mental Illnesses number 5. Now this is an official publication of the American Psychiatric Association. It's actually the gold standard that all psychiatrists and all use, but it's a bit big. It's a little expansive for an MBBS course. So what we're going to do is we're going to be doing something called as the common classification of mental illnesses. This is a brief overview of the common diseases afflicting the mind. The first among them is the anxiety disorder. Now, this is characterized by feelings of fear or anxiety. This causes a bucket load elevation of autonomic hyperactivity in the individual, and this gives out manifestations like sweating, increased heart rate, increased respiration, tremors, and this kind of keeps on going uncontrolled until the anxiety or the trigger is driven away. The next common condition, the second one, is something called as mood disorders. Now, these are characterized by a sudden or very severe change in an individual's mood. The example for that is depression or bipolar disorders. Now, this is fairly common in India, and people are warming up to the idea that depression is something that happens to a lot of people. One of the biggest names in creating mental health awareness is Deepika Padukone. Now, she was an actress, a sports person, and she's a very vocal proponent of mental health because she herself suffered from depression. The third condition is substance use disorders, or what we call as addictions. Now, this is defined as use of one or more substances which causes a clinically significant change or an impairment or a distress in the individuals to function normally. This is commonly seen in individuals who are addicted to substances like alcohol or opiates or the like. The fourth one are personality disorders. Now, these are a maladaptive pattern of behavior which cause a long-term difficulty for the individual to function normally in society. A very good example for that is dissociative identity disorder, or something that we call as multiple personality disorder. Now, this has been shown in quite a bit of movies like Split or Me, Myself and Irene, or the legendary movie Psycho. The fifth group of common disorders is eating disorders. Now, these are basically conditions in which an individual suffers from a range of psychological disorders which has abnormal or disturbed eating habits. The individual will not eat anything, called as anorexia, or he might eat quite a bit, called as comfort eating. The most important among all of them I've saved for the last. Those are the psychotic disorders. Now, these are disorders which actually have an element of abnormal thinking and abnormal perceptions. The most common example for this is schizophrenia. Psychotic disorders have a very huge variety of symptomatologies. They include delusions, hallucinations, agitated behaviors, etc. The MCQ aspects of the classification of mental disorders is relatively low. You don't get a large number of MCQs from this particular part of the subject. What you may get is a set of MCQs detailing a set of symptoms, and the question might be whether they belong to anxiety or depression or psychotic disorders. Now we move on to a specific condition called as post post-traumatic stress disorder or PTSD. Now, this is a modified anxiety disorder which is characterized by the failure to recover after experiencing or witnessing a violent or terrifying event. Now, this is generally seen in individuals like children who were abused when they were young, soldiers who returned from the war front, or survivors of sexual assault. PTSD retains its importance primarily because this happens as a part of a memory trigger rather than something that happens in the present, which is why relapse is relatively common with PTSD. That's an MCQ for you guys. The management of PTSD involves a group of drugs called as the selective serotonin reuptake inhibitors, or SSRIs for short. SSRIs are the drug of choice for PTSD conditions, but they are not exclusive to PTSD, and they are also used in conditions like anxiety, depression, OCD, etc. That's another MCQ for you guys. The second aspect of PTSD is repeated psychological counseling. That ends the session for today. I hope you guys got a brief idea about the classification of mental disorders. Keep those critical reviews coming. Keep those questions coming. Here's to the next time. This is Dr. Som Sharma from Forensic 101 signing out. Ciao.